I'm Ellen Heed, founder of STREAM, and STREAM stands for Scar Tissue Remediation, Education, and Management. I believe that scar tissue is the unacknowledged cause of too much human suffering, so I developed STREAM to advance professional training for healthcare practitioners. STREAM gives healthcare providers of all stripes the tools they need to effectively address scars and amplify human potential as a result. I'm so proud of the work that STREAM graduates are doing that I made this video series to highlight their accomplishments. In this clip, I interview Victoria Gyore, a certified STREAM graduate who works as a pediatric nurse practitioner in the emergency room of a children's hospital in Orange County, California. Let's talk about how Victoria reversed disease. Whose disease? Her disease. In this video, Victoria describes how she used her body as an actual laboratory, using whatever medical equipment she had access to in order to explore the results of dietary change that reversed metabolic syndrome and high blood pressure. She proved to herself that by changing her diet, she could not only control her blood sugar, but also high blood pressure and other inflammatory indicators. Check out her inspiring journey with GAPS, a nutritional protocol that got real results in a shockingly short period of time. Enjoy. Continue on and talk about your process when you decided to experiment with your biochemistry, your personal biochemistry, and what prompted you to do that?
Yeah.
Well, how did you get interested in GAPS?
So 3 months, it's literally like being in school, which I love because I'm a geek. But I left that workshop knowing that if I didn't do something, I was going to be a sick person in a doctor's office waiting room. And I knew it. And I had to go. I had to move. I had a lot of things motivating me. A couple of months prior, I became a new grandma. I'm a boy mom. I had my children, but it was the first time that I experienced being a grandma. And I wanted to be a grandma who could move and who was healthy and well. And I knew that through the childhood trauma stuff, the way I experienced birth, especially with my first, and being a teen mom, and then entering Western medicine and practicing for so long, working night shift, graveyards, that I had burned the candles on both ends and that my body was showing signs of metabolic syndrome, hypertension, and that I just didn't want to pop pills. And I didn't have time for that. I didn't want to be a sick person. And so I need to move. I don't have a choice anymore.
Mm-hmm.
And I felt that at a very deep level, like in my bones, in my cells, like I gotta go. I gotta move.
And move you did. I mean, I never saw anybody dive in with such enthusiasm immediately. But this is thematic for you. And in the course of this conversation, you're somebody who sees the future and walks toward it with full commitment each time because of some very deep intuitive connection you have to your path. And it seems like GAPS became a way to escape a medicalized future.
Mm-hmm. Yes. And to give a little background, now I feel like I'm very connected to the disciplined Victoria here, but we talk about it. I loved In and Out. Like I love bread.
Yeah.
The person I was before GAPS was, I was going through drive-throughs and even now it astonishes me because food was my addiction and my high and reward. And then it just shut off. I just woke up one day and there was an end to it. And we were doing this. We were coming back from workshop and we were starting and off we went. Off I went.
Well, things changed dramatically in your body. I mean, did you think of yourself as a lab rat from the beginning? Just, in terms of this is an experiment, and because I have access to all this equipment, I can follow my physiologic progress through this program at a very acute level, acute not in terms of emergency, but acute in terms of attention to detail, right?
Yeah.
Yeah. So you did all the things, right? You checked your blood pressure, you had a blood glucose monitor, you were monitoring your A1, hemoglobin A1C,
Yeah.
and looking to see changes.
Mhm.
And it seems like you got pretty immediate gratification.
I did. I mean, in three days in GAPS intro, I had like a completely different body. I had, you know, my extracellular matrix was feeling the transformation. I was feeling it in my tissues. I was feeling it in my mind. I was feeling it hopping in and out of altered states as I was drinking my soup. I was feeling it in all the four domains.
Mhm.
Um, it was profound.
And it seems like you were getting some feedback as well from the mechanisms, from your blood glucose monitor or from taking your blood pressure. I mean, there's nothing like a little support from numbers, you know? Talk to me
Oh,
about that.
I love it. I was getting to a point where I could tell when my blood pressure was up, and I was using, this was probably not in beginning intro. This is when I started using beet kvass. And I mean, she's a big mama. Like I call her a big mama. She's powerful medicine. And so I was able to use beet kvass and figure out the amount that I needed to take. And then I would do my blood pressure or take my blood pressure 30 minutes to 45 minutes afterwards and see the changes. And I
Oh,
was like,
wow.
this is just amazing. I mean, I don't think there's a blood pressure medicine that has this like this good of an outcome with low, like no risk. I don't think any food has ever made me feel like that. Not In and Out for sure. In and Out never made me feel like I wanted to be here, but Beet Kvass grounded me into this earth, into this time, into this being, into this body, into this flesh, so that I want to be here.
Amazing.
One
Amazing.
teaspoon. That's why I love
Wow.
it.
Amazing. Do you think it was the microorganisms in it that were talking to your system, and because they were different, you were responding differently? I wonder. I think there's so much intelligence inside of our intestines that has to do with the conversations between the vagus nerve, our endogenous microflora, and introduced microflora that may have new information that we need, but we don't know we need it until it
Mhm.
arrives. And then suddenly, there's a sort of epiphany of
Yeah.
a shift of some kind, like we get really calm, or we get kind of happy, or we relax in some way, or something just shifts. So the reason this is important is because people don't understand how immediately and specifically gaps will affect your physiology. But you're saying you can watch the effects sort of rolling through real time, from a kind of a blood sugar spike to a blood sugar normalization in a relatively short period of time with no negative side effect.
Short term, I had hopes that this was really going to help blood pressure and blood sugar.
Mm-hmm.
When I really started seeing the numbers drop, it was still pretty shocking from my Western medicine mind that it wasn't a pill, that this was actually food medicine, and really feeling it in my body. People talk about it on the Instagram streets, food medicine, but when you actually see it and feel it as medicine in your body, it's profound. It changed everything. That felt experience, it changed everything in that sense of confidence of being able to speak to what is possible. Um, I started feeling more easeful, more open to share my journey. And what was happening is people were coming up to me because I lost 10 pounds quite fast.
Yeah.
And people kept, like, the doctors would come up and be like, what's happening? What are you doing? Or the nurses would come up. So it was a noticeable change. And
Yeah.
so people were coming up asking. Um, and so sharing my life. And then when patients would, I would interact with patients in regards to just wound healing, something simple like wound healing.
Mm-hmm.
And it was just easy after, sewing a laceration to talk about nutrition, to talk about biochemistry.
Mm-hmm.
And every night when I shared the information about biochemistry and what foods are inflammatory and what foods promote wound healing and collagen production and all the good stuff, every parent says, nobody ever talks to me about this stuff. Nobody's ever said any of this to me. You're the first person. And I'm like, well, we're talking about it today. And that is one of the pillars of patient education is biochemistry. So it changes everything.